Hi everyone, welcome to Pinky Sardine Talk series, and this is my guest Odin, my cat. This video will be in English because I choose a general topic, and I will put the Turkish subtitles also. And let's see the video. Hey. Okay. Gel. Vallahi manyak. Bunun seninle hiçbir alakası yok Odin. I will talk about coronavirus, so this is the reason this video in English. This is an important subject for us nowadays because World Health Organization just announced as of March 7 there is more than 100,000 people infected by the coronavirus. Sometimes we will lose our eye contact because I have some notes, and also I have a cat. Move. Okay, now it's better. And also World Health Organization warned every country to help each other to reduce the impact of this coronavirus. In this video, I talk about what is coronavirus, how it spreads, how we can protect ourselves and families. And I think the most important part, because there is no medicine for the coronavirus now, but tomorrow maybe it can be found and this video will be old. Most important part, I think, mother and child relationship about the coronavirus. For example, pregnant women, what will they do? Something like this. Let's start with what is corona. Corona, think about as a word. What is corona word coming from? And people are saying this coronavirus, COVID-19, and 19 is 2019. O for corona, Y for virus, and D for disease. Corona is a new virus linked to SARS family, but what is the difference from the SARS? How does the corona spreads? Coronavirus is transmitted through directly contact with the infected people or the respiratory droplets of an infected people, like coughing and sneezing, and also touching surfaces contaminate with the coronavirus. What is the symptoms of the coronavirus? There are three main symptoms for coronavirus, and like standard flu, they are so similar with standard flu or cold. What are these? Cough, fever, and difficulty for breathing. But what is the difference? Much more than a standard flu, much more frequent. If you or your children or your family members have one of these symptoms, what should you use? First, you will seek the medical help. You should go to a doctor, go to a hospital. Otherwise, wash your hands immediately and stay away the public places for the sake of the others. And nowadays, and generally, as an ethical attitude, what we should do? Frequent hand washing. When we cough or sneeze, to cover with a tissue or the elbow, like this. And the tissue is important also, because use a tissue, it's also important you should throw away the tissue in a closet bin also. You should avoid to touch your eyes, nose, mouth, like face. You should avoid to touch your face when you are outside or also at home before you wash your hands. If you ask about what is the proper way to wash your hands, I'm sure everybody knows what is the wash your hands in a proper way. To protect yourself from this kind of virus, not only for the coronavirus, it should be at least 20 seconds, and this is important. And also, you should wet your hands under the running water and use enough soap, and if there is no soap, use some the other liquids, includes alcohol, and these liquids should include at least 60% of alcohol. And wash your hands, all your hands, I mean up, under, between the fingers, and also under the nails. You should properly wash your hands at least 20 seconds. And then, when you dry your hands, you should use paper towels for one time. It's more clear. And There is another subject. If you need to travel these corona days, stay at home, don't travel. But if you really need to travel, there is nothing to do. World Health Organization published a list, some country list in fact. This list shows you if there is a quarantine or this area, maybe your country will not accept you again if you go to this country. You can find this kind of information in the list, which under the video. Okay, sorry. Let's talk about the most important subject. If you are pregnant, what will happen? If a pregnant woman, is it possible to can pass the virus to an unborn child? There is no enough study for this subject, but doctors are saying, oh, yes, this is possible. Dramatic. There is also something good, something positive for the child and mothers also, infected mothers. If there is an infected mother with the coronavirus, people are asking, is she still can continue to breastfeeding? Doctors are saying yes, she can, because I'm not saying this. Unicef and World Health Organization is saying this, because the breastfeeding and breast milk is so important for kids' immune system to protect the kids from this kind of flu viruses. So doctors are saying a mother who is infected with coronavirus can continue to breastfeeding, but if the mother is so ill, she can express her milk and also can continue to serve the milk to the kid via a clean cup or something like this. Pets. What about the pets? And there are some questions also. Is it possible to catch the coronavirus from our pets, like dogs, like cats? No, until now. Because we think about SARS virus, for example, SARS was associated with some cats. So you should also protect yourself again. For example, to protect yourself, what can you do? You should avoid to touch raw meats, avoid to drink raw milk. Maybe you can use pasteurized, or maybe you can boil the milk, I don't know. And also you should avoid to touch surfaces, contact with the animals directly. And surfaces is also important. For example, it may change humidity, temperature, type of the surface. But this virus, and also there is no enough study for the surfaces also, but scientists are saying it seems to act like the other flu viruses. So this virus also can live, can persist on the surface minimum 3-4 hours and up to a couple of days. So do not touch the surface, and always do not forget to wash your hands. I learned all this information, all this data from the World Health Organization, Unicef, and some other reliable websites, so also you can search on it. And maybe there is no medicine now for the coronavirus, there is no cure now, but maybe tomorrow this video will be an old video, maybe somewhere, maybe in China, in Japan, they will find the cure. Okay. So, keep online, keep watching. Thank you for watching. Bye everyone.